Walking through the wards of Kawolo General Hospital, the extent of the industrial action that started today becomes clear. Patients with desperation etched on their faces were left stranded. Some of the patients opted to go to distant health centers. This left some empty waiting seats that were abandoned by patients after they opted to leave. Felix Chigoma, a clinical officer at Kawolo General Hospital, shared that although the workers received their salaries for April, they had not been paid for the months of March and May, with the end of another month without pay approaching on June 15th.
These guys don't give us much salary. The March arrears. We shall not work. If they are wise and if they are hearing, instead of processing May, they should first process March. Wait. Or they should send us 2 months, March and May. And when it comes to 15th of this month, which will be a Wednesday or Thursday, it should be 3.
Yes. The health workers say they issued a notice to the Chief Administrative Officer last week, who had promised to meet them on the matter. However, upon seeking an appointment with the Chief Administrative Officer, the health workers claimed they were virtually ignored, although it was clear he was in office. The health workers have since insisted that they will only attend to critical cases and emergencies, despite the ongoing strike.
The first department is maternity. We have to save life, that is an emergency. The second is accident and emergency. But we work on only emergencies. And if a patient comes to emergency department, don't admit as a clinician or a nurse. Theater is only going to work on emergency cases.
The striking health workers explain that, like other professionals, they have pressing financial needs, including payment of tuition for their children and loans that are due.
For us, we have brought our faces on front so that we can fight for the whole of Kawolo Hospital. So nothing to say about that, but we need salary. No salary, no work.
The Permanent Secretary of Public Service had this to say regarding the matter.
Had a tripartite meeting in March between Ministry of Finance, Ministry of Public Service, all accounting officers, human resource officers across ministries, departments, and local governments, as well as their planners, to see what is going on the ground. And every issue, including wage shortfalls, was documented, catered for, and supplementaries were issued to this effect.
Kawolo General Hospital is a critical referral hospital not just for Buikwe district, but also parts of Mukono, Kayunga, Buvuma and Jinja districts. All this comes at a time when the Ministry of Health is battling to pay billions of shillings in utility bills as well as salary and allowance areas for hundreds of doctors across the country. It is unclear how this crisis will end.